Hello, everybody. Sorry we're a little late. We had some miscommunications, but here we are. I am so excited and absolutely filled with gratitude to be able to be your moderator for today's event and to be able to share this space with some incredible leaders of our youth generation. My name is Leylah Murad, and I'm a current student and NCAA athlete at John Jay College of Criminal Justice in New York City. I'm also one of the current directors of marketing and strategy here at LookUp Live. So often Gen Z gets a bad representation, and with this cohort of leaders today, everyone who is listening and watching will have some faith restored in us and realize that we're not all that bad, and to be able to see that we're actually creating monumental change in this world and for the digital future. And realizing that Gen Z is the future is nothing scary. Thank you to everyone who is tuning in from wherever you are. Our session is titled Breaking Down Barriers, Teens Talk Mental Health, Stigma, and How Social Media is Rewiring Our Brains. We're going to really hone in on how we can destigmatize mental health within our communities, some past experiences we have with digital addiction, and some plausible action steps we can start taking individually to create change. Also, please note that we will not be able to read the audience's questions as soon as they come in, but our back-end moderator will be able to feed it to us, and I will be following along on my phone also. With that being said, I hope you enjoy everything that's going to happen today, and I'm going to have our lovely speakers briefly introduce themselves, starting with Seika Brown.
Hi, thank you so much for introducing us. My name is Seika Brown. I am a 19-year-old student at Cornell University, a sophomore, and I run a global research initiative that focuses on how do we define mental health across cultures and backgrounds. So I spend a lot of time using the digital world as a way to communicate people's stories and people's perspectives and people's backgrounds. And I began my work when I was about 15 years old, when I was a sophomore in high school. And I spent 3 years working in policy, where I ended up passing one bill up in Washington State. And when I came into university, I switched into a research perspective. And honestly, what inspired me to get into mental health is my brother's own struggle with it. I was 8 years old when he attempted suicide. And so I think it's really important to just listen and hear people's stories. And so I'm really excited to be here.
Thank you. Thank you so much for sharing. Yeah, Lars.
Hi, my name is Lars Bjork. I'm a 17-year-old senior at Concord, Carlisle High School. And my brother passed away 2 years ago from suicide. And I was able to watch his, struggles with mental health. And that's kind of what got me interested in it. And so my family runs a nonprofit. And the name of it is the Bjork Foundation, and we do some stuff to try and destigmatize mental health and get education about it. And I also run a club at my high school called Bring Change to Mind, that's based around destigmatizing mental health and just having the conversation about it. So yeah.
Awesome. Okay, going off what you just said, Lars, can you kind of explain what action steps schools can start to bring on how to bring awareness and destigmatize mental health, and what that could actually look like based on your previous experience?
Yeah, so I think the antidote for stigmatization is education, and as brain health literacy increases, more people are able to seek help. So if people actually understand what brain health is, then they don't feel so awkward getting help. So the Bjork Foundation has created this boot camp, the Brain Health Boot Camp, that's supposed to give people a baseline understanding of what brain health is. And so we've been rolling this out to schools in Massachusetts. There are 3 schools right now are already doing it this year. And basically it's just a 30-minute boot camp that allows anyone to get that baseline understanding, and then also have the resources to help support people that are struggling. And I think that it's really important that schools do this the same way that we have sex education in schools to help people get their baseline understanding of that. I think that it's really important everyone understands what brain health actually is. And especially with social media these days, I think that it totally increases mental illness. And so it's even more important that we make sure people are equipped with the knowledge and resources to find help.
Yeah, 100%. Thank you so much for sharing. Seika, can you touch upon what power students actually have? I think so often, many people think that they don't have any power and they don't know how to get involved or what they can do. Like, they're just an individual. What can I do? What can I do in my community and with myself? So can you really touch upon the power students have and in creating digital change, and what can you tell those who want to get involved?
Definitely. I think one, especially the young generation, like our generation, we have the ability to actually use technology at its, highest extent. Kind of just building off of what Lars said, I think listening is a huge thing, but part of listening is also sharing your own voice. And I've said this before, and I'll say it again, that a lot of kids think that they have to go find their voice, find a place where they can use their voice. But I think it's totally the opposite, is that, you take one self-reflection and realize that you've always had your voice with you this entire time. And now it's just, you can use technology, you can use the digital space as a way to promote your thoughts, your ideas, what you're feeling. And I think once we realize that there's not any huge steps that you have to take. It's a very minimal thing. It's about like reflection. It's about taking time to understand where you come from, realizing your own perspectives, your own struggles and your own troubles, and going through that. I think a lot of it is just kind of realizing where you come from and being like learning to be comfortable with sharing it. If you see people that aren't necessarily sharing a story like yours, or you see people who are, you can always contribute. Like I said, I think we have a special ability as as kids, as a younger generation, to utilize technology. I think the first one is just to share within your community. Like that's the first step. And from there, you can really do anything. The moment that you realize that your voice weighs and has power and has the ability to share something is the moment things actually change. So it's a lot of reflection and just taking a moment saying, yes, no, I actually have something worth time and worth people hearing, and also doing vice versa. It's like listening to others people too. So I would say that would be the first step.
Thank you so much. So I'm actually going to jump in and we're going to answer one of the questions from our audience, and that is, how can we use social media to wire our brains for bringing good into our lives? So often, much of this whole summit is based around how social media is harming us and what can be done to, what are the good things? What are the opposite side of that coin? And how can we use social media for good? And how can we use social media to wire our brains for bringing good into our lives? Whoever wants to answer, can answer.
I can talk about this one. So the Chase Bjork Foundation we've created this pledge called the Brain Health Pledge, which is basically just a movement online that spreads support to show, it's saying that we see the person, not the illness. And we think that it's like a way of changing our outlook on what mental health is. And so basically everyone draws like a green heart on where it's a green heart anywhere, and you can post it to social media, and you have the pledge below in the description, which is just saying that you see the person with the illness, and nominating other people. And I think it's a great way of showing support online. And I think a large part of brain health problems that people feel so alone, and it's something that's not talked about nearly enough. So people feel like they don't really have anyone to go to, and that no one is supporting them. And I think that it's really important if through social media we can show that this matters and people are taking it seriously, and there is support for those that are struggling. That makes a huge difference. And so the hope with the pledge is to show that support. And it was actually started a bit ago and actually caught on for a while. dropped off a little now, but I'm sure that there'll be another pledge sometime soon that we can do.
Awesome. Thank you. Thank you so much for sharing. Yes, I really, I want to point what you said about how often we feel alone. I know a couple days ago, it was World Mental Health Day, and I saw so many posts about social media, and I'm like, oh my goodness, imagine if we brought this much awareness every single day and not just on World Mental Health Day. These are the kinds of conversations that can need to continue to be happening constantly, and to realize that you're not alone. Oh, and just even seeing someone's story or someone's repost about saying, oh, I'm not the only one who feels like this. Weird. Wow, there's actually people who can relate to me, and sharing their story is powerful. Yes, I just really wanted to touch about how you said they're not alone, because so oftentimes it's so easy to feel lonely in this world, and it's important to realize that we're never alone no matter what. So yeah, thank you so much. Okay, so Seika, we're gonna have another question from our audience, and it's going to be, sorry. We've all seen mental health awareness posts online, but what posts are most effective in mental health education?
Yeah, I mean, I think kind of touching on what Lars said also, like on the education side, is that obviously I think we shouldn't end mental health awareness at the social digital world. I think that's a place that can be used as a tool. I don't think we should limit ourselves there. But I think, for example, there's a lot of, young people driving programs, like, different kinds of educational things within their own state, within the country. I think raising awareness about the actual physical programs that people are working on that will bring change will be really important. Like, we can share as many statistics as we want, but I don't think it necessarily brings a lot of awareness to it. I think what we should bring awareness to is the programs that people are working on, is the organizations that are raising money, that are raising research. I think those are the things that we can start sharing. Like, for example, we see that on World Mental Health Day, as you said, like we see these organizations talking about what kind of work they're doing to promote mental health wellness in schools. And so I think that kind of awareness is like the main post that we should start seeing using in the digital world. I think it's good to share like I think it is good to like confirm and help people and listen to people saying that this is a common struggle, but also showing people that this is like a battle that we're fighting together by showing the programs, by showing what people are working on to improve mental well-being. So I think a lot of it goes down to education, but also not limiting ourselves just to the statistics of mental health, but also what we're doing to make mental health better.
Absolutely, absolutely. Also, I know you have some previous work. Can you touch upon some of the previous stuff that you have done? Because I think it's really powerful what you can do even as an individual, and kind of share your journey about that, and realize that you can actually create change even on the legislative level.
Yeah, definitely. I think I started when I was 15, when I founded my first organization, I started with like this whole online awareness, like kind of thing. And for a while it was really good, but then I realized, like I'm only reaching a certain audience. It'd be really good if we're able to bridge these conversations that I'm having online in person. And so my organization at the time and we ended up working in the Washington State Legislature. And we passed a bill around uniting basically students and representatives within the state. And so what we ended up making in Washington State is these wellness, these like school safety boards, basically where students from different school districts are able to be in direct contact with people policy change makers. And you see this kind of like bridged area where people are able to talk. Like, for example, with COVID, it was really good because struggling districts were able to say, no, this is like something we really need in this local area. And then the representatives could bring that. So that's both true for physical health, but also mental health, and was a big thing as well. And I think, like you said, like it's kind of hard to think that, oh, like how am I supposed to like get involved myself? How am I supposed to start myself? Right. Like I said, a lot of it is self-reflection. A lot of it is taking the time and realizing, yes, I can do this, but also like, it's just like raising awareness within yourself. Like, those social media posts that we repost online, like, let's like take a second and like look at the organization itself. Why don't you reach out to them? The post that you repost, why don't you reach out to them and be like, okay, how can I work with you? What kind of programs did these organizations work with? I did a lot of like background research. I looked at all the organizations that I kind of like liked. And then, I kind of reached out in the what if they were going to like respond to me, and that ended up working really well. So I think a lot of it is just utilizing the fact that this is a conversation, but this is a rising conversation. conversation, and people want youth voice. They need us a lot more than we need them. And like, we have created with the digital world, like our own space. And the adults that are making these policies, the adults who are making these programs need us to test them. And we are the ones who are able to tell them whether or not this is a good program or this is a bad program. And so reaching out and being like, hey, I want to be involved in the next legislation session. What policies are getting talked about right now in my state? Asking to get involved in those things just by emailing them online is like the best way to start, because people want to hear from you. And then you'll realize, you're like, wait, you want to hear from me? And it's like, it's just this nice, like, idea that the adults also want to listen to us. This is like a mutual field, and we need to make sure that we take care of both our students and our teachers. And so in the education setting. And so with the research that I'm doing now, a lot of it is listening to other people's stories and like thinking about what other experiences are happening across the world and what programs do other countries have, and like looking and comparing those kinds of things. So a lot of it is just like, you like an organization that you're reposting online, like check out what they're doing and see if there's a way you can get involved through them. I think that's the best way to start.
Right, you never know unless you try. Yes, thank you. Lars, okay, so we have a question from our audience actually, and I think you could help answer this. So it says, what are the first warning signs that social media is negatively impacting the mental health of a teen? Oh.
Yeah. Well, I think that when someone feels like social media is something that they need to, it's when they are resorting to social media as like a coping mechanism or something. Social media shouldn't be something you go to when you're struggling. And it so often is, especially with teenagers. It's so easy to fall into your phone after, having a bad day or something, and something goes wrong and you just want to, you're scrolling and you just can't stop. And I think that social media is something that everyone has to deal with. It's a constant, we're always trying to separate ourselves from, the addiction that social media is. And I think that it's absurd how the apps have just created like drug-like addictions with teenagers, and it's basically there's no consequences for them for what they've created and how many people actually get hurt from it. And I think that warning signs are people just feeling lonely, resulting to their phone when they're in distress, not talking to friends, feeling like they don't really want to go out in person. And I think that that's another issue that social media has made, is like you're able to stay social while you're separated from everyone. And it's just so interesting how the one thing that's supposed to be, making everyone more connected is separating us further apart from each other. And so I think that what I'd encourage a lot of people to do is just, get off your phone for a while. Try hanging out with people and socializing, and then it's not such a scary thing anymore. I think that another warning is like when people are scared to go out in person. I see that a lot when people are struggling. They don't really want to have to talk to anyone, and I just think that social media has made that way too easy. And so yeah, that's something that we all need to look out for.
Thank you so much. I hope that was insightful to our audience, and I know that was insightful for myself as well. Yeah, I mean, the scrolling. I made this post actually the other day on my Instagram saying how the first 40 minutes when we wake up, our brain is the most programmable. So like we're just coming back to our consciousness. So our unconscious mind is really still very present. And so when we first wake up, the first thing you do, it should not be to check your phone. It should not be to go and absorb and absorb and absorb. Sit, really ground yourself, write out what you're going to do for the day, write gratitude. You know how much gratitude actually like changes your perspective on things. It's beautiful. Write 3 things you're grateful for, whether that's being alive or having water to drink. Like little things like that really does make a difference. And it's just, little things like that can really set your day up for success and change your perspective on things. So the first thing, just to anyone who's listening and watching, when you wake up, please don't check social media for the first time, because I guarantee you those programs are going to try to get in your brain when you can create your own. So yeah, we're going to go to another question. So it got asked, if we don't have a personal story to share, how can we contribute to posting an effort to destigmatizing? Whoever wants to answer can answer.
Yeah, I can step in. I think there's this huge, obviously stigma around the fact that you need a quote unquote story to tell when it comes down to mental health. I think there's a huge misconception. Mental health and mental illness are 2 totally different conversations. You don't need to personally struggle with mental illness, and have these diagnoses to actually spend time talking about mental health. Talking about mental health is the same thing about talking about physical health, right? It's about taking care of your body. It's about whether or not you go work out. It's whether or not you, do exercises or, take time for your physical well-being. Mental health is mindset. It's about that gratitude that you touched on. It's about having, taking the time to like make sure that you're mentally well. And so I think a big misconception is that you don't have a story. You do have a story, and that's just the way, like, that's just who you are, like just the things that you like and doing in the day. I think a way that you can be actively involved is in talking about the fact that like maybe like there's things that you do or have in life that make you happy. And I think a lot of it is overturned. I think we need to start having conversations about mental health, not about is like it's like a lot about, it's not a lot of like you have to I did not mean to raise my hand. Anyways, it's not about like what you can't or cannot tell. I think what it's really about is the fact that we all have our own personal perspectives and experiences. You don't need to go through something like terribly, terribly tragic to just talk about mental health. I think that's a big misconception. Your life on its own is good enough. And that's a lot of stories that people want to hear anyways. And so I think a way that you can just be involved is, listening. I think, as I mentioned before, that is part of like gratitude. It's listening to other people who don't have the space to talk, and being that person to listen is like the most important thing. Cause like, that's like the number one thing that we have skipped over to do for like decades. If we only listened in the beginning to other people, these are like problems that we have today would have been avoided. So if you feel like, yeah, you still want to involve, but you don't know what to talk about, maybe take a step back and say, okay, no, I'm going to be the person that listens to others and share the stories of other people. I think that goes a lot further than just talking. Listening to those in your community, listening to those who struggle does a lot more than you just putting in your 2 cents too. So I think it goes back to that as well.
Yeah, I totally agree. I think that like you don't, I know that you don't really need to have like a story that's, so dramatic about, someone passing away or someone going through a horrible experience. I think that everyone deals with, mental health to a certain extent, and it's around us. Like you can't really avoid it. It's 1 in 5 people, I think like 1 in 5 adolescents have it. And so anywhere around you, mental health is there, and it's something that you need to be aware of. And I totally agree that you don't need to be doing some huge activist movement to have an impact. I think being educated on the topic and being able to have good insight as to how to navigate it, and if you see someone struggling, be there for them, listen to them, help them find the resources if they need that. And if you're educated, you're helping, because what mental health actually is, not the stigmatized version of it. And that's what's super important.
Yes, great points by both of you. Thank you so much. I think we have a parent in the audience, and they're struggling, saying, if I say get off the phone for a bit, the teen doesn't listen. So what are some kind of alternatives, for our parents out here who who are listening and are like, if their child comes to them and are like, hey, I think I'm struggling with digital addiction, or if the parent just notices that they're on their phone a lot, instead of just saying, get off your phone, and the teen's like, okay, like what's next, you know?
I think kind of just the fact, okay, like addiction's addiction, whether it be like with drugs and alcohol or even coffee, for example, it's hard to break. So one, realize that if your child has like a digital addiction, it's just, it's just it's a stimulant. It's hard to break. So you have to give them a break in the fact that like, if you can't go every single day without a cup of coffee as a parent, think about the fact that maybe your kids can't go which isn't a good thing. They can't go like without scrolling on Instagram or TikTok for hours on hours. I think the way that we talk to people, whether it be your kid or a student or even a friend, is super important. It's about diction, it's about tone, it's about the way that you want to present yourself. And if you actually care about a person, right, if you love them, you're not going to come at them in a way that's going to kind of make them run into a corner. If a person's addicted, especially to like social media, I mean, like obviously that's not good. Like Lars was saying, that, it's good to take time to put the phone down. I think it's much better to actually give someone, feasible steps than it is, oh, put your phone down. It's like, hey, like, why don't we try to limit your screen time? Or, hey, why don't we try doing like a family thing together? Like there's options to make these things decrease. I think by utilizing those kind of things, it makes it a lot better than just going, oh, hey, you should just get off your phone. It's like, it's not that simple when it comes down to stimulants and addiction. And I think we forget that these apps, that our phones are, part of those things. And so realizing it's not easy to talk about, like it's not easy, like it's easy to say, but it's not easy to do. So just taking a time to think about your child and your addiction, the way that you're talking to them, and are you actually giving your kid any, feasible things that they can do, or are you just telling them that they should do something, but they don't know how to do it themselves? So I think a big part of it is giving them feasible options, or helping them find feasible options for themselves. Like, okay, like what is it that you want to do more? And like, I think there's ways that you can communicate with your child. Like, again, like addiction's addiction, it's hard to break. But I think what's important is that you're going to be with them as a parent, like helping them through their highs and lows of battling with a quote unquote addiction. Like it's hard to think, because addiction has like this negative connotation around it. But, and I think it's easy to break if you don't shun them or shame them for the fact that they have it in the first place. Like you don't do that when someone talks about like having like a drug addiction. You help them through it. It's the same way.
I totally agree. I think like the way that we try and break habits from drug addictions, those can be similarly applied to addiction to the phone. I think that a huge part is like getting other hobbies or habits that are positive, and maybe it's going outside, playing a sport, going for like nature walks or something, do some creativeness. But yeah, any of those things are always helpful. And as a parent, maybe monitoring their screen time each day, trying to get it lower and lower. I think they send out like, your percentage from last week, if you're up or down. The way I try and monitor myself, I try and stay pretty active about, only having a certain amount time each day on my phone. And I'll check in at the end of the week and see, how well I did, if I was on my phone too much a certain day or something, and why that was. And I also think, what you're doing on your phone is super important. You can, obviously, it's an amazing tool. Like there's so many positives, but there's also so many negatives about it. And so, your screen time, what you're doing, like TikTok is just, it's such a poor way to spend your time on your phone, just constantly. It's like they've just hacked the psychology of your brain, or just feeding you like things that you already know, but you're just going to keep watching. And these apps intentionally have bad content in between good content to keep you scrolling. Like it's, I don't know. And so I think that there's a big difference between, reading an article or something online, or texting and calling with a friend. Maybe you're in like a long distance relationship, who knows? But the way you spend your time on your phone is super important. And I think that if you're able to limit the amount of time you're spending on social media apps, that is huge, because that's what drives you back and gives you that like craving of using your phone. So yeah.
Yes, absolutely. Oh my gosh, I love checking in on my screen time as well. And I know what's when it's too much and when it's too little, because I've been tracking it for a long time now. And these apps know exactly what they're doing. They know exactly what they're doing. And I think it's also frustrating because of the lack of accountability. Also, we've seen a lot in the past month actually, with Facebook being exposed, and that's a whole nother conversation for a whole nother time. But yes, you know, just being aware of, like, I like what you said, but just being aware of how you're spending your screen time. Is it used for texting? Is it used for emailing? Is it used for social media? Or is it used, for actually connecting and engaging in the proper right ways? Also, just kind of wanted to add that we are more powerful than you think, no matter what. If you don't have to engage in social media in the typical way. You don't have to go and you show off your cute and your fancy cars, or like anything that it tells you that you should be doing. Go share a story, go share what someone did to you today, or like, you had a bad day, share your bad day. Don't just share your good days as well, and be surprised how many people actually relate to you, and then that starts conversation as well. So it's a matter of how you use social media, for good or for bad, and to also not be scared to steer away from the status quo. Don't be scared to, be yourself. Yes, okay. We're gonna have one last question. I really enjoyed conversing with you guys. Okay, so do you feel that mental health struggles are actually being destigmatized? What more can we do for the youth to feel comfortable asking for help?
I would just say, like, I totally think that there's been major progress with destigmatizing mental health, especially in the past couple of years. I think COVID has really made people come to the realization that this is something we really need to, tackle together. And I think that so many people, some like parents and everyone, was really able to see the damage that social media is doing when we were put into isolation. And so it's just, I mean, people are talking about it more, which is great. And I think that we're definitely on the right trajectory of taking care of this problem. And was the other part of the question just asking what we can do to help get support?
Yeah, what can we do for the youth to feel comfortable asking for help?
I think that people feel a lot more comfortable when they really understand, what mental health is. Like I was saying beforehand, that education, like, and seeking for help both run parallel together. You're able to, if you really know what mental health is, you feel less, social pressure around not getting help, and maybe it's getting a therapist or something, or getting treatment. And I think that the more we talk about it as well, the more people are able to feel comfortable getting their help. And if no one talks about it, then it's just this like taboo topic that no one really wants to hear about. And I think that if we're able to really have that conversation, parents, feel free to like talk to your children about mental health, make sure that they're supported, and they know that if they're struggling with it, they can get help. And I think that also spreading the resources of how to find treatment and help is really important too. So yeah.
Thank you, Lars.
Yeah, and I think just to like quickly wrap it up, like on that part, is that I definitely agree. I think mental health destigmatization is definitely, like, I think we're talking about it in the right spotlight now. But I think we're at a very vulnerable point where it's like we need to make sure that we're continuing conversations in this way, because I think it's going to be easy to slip back into the way before. But I think, yeah, I think it's important to hear both I think it's what we should do is listen to not just the young generation, but the old generation. As the younger we get and the more we talk about it, I know it's difficult for the parents who have lived their entire lives not talking about it. Now suddenly their kids are demanding them to talk about it as well. So I think a big part of it is just coming into this, like, no, mental health is for everyone, right? It's for your 2-year-old and it's for your 80-year-old. Like there's no requirement to have mental health. It's just you're human and you have it. And so I think the more that we have these conversations and are willing to listen to others, whether it be our friends or within our family, I think the more that we can both, help others and continue this way of destigmatizing mental health in general.
Thank you, Lars. Thank you, Seika. Thank you so much. I really enjoyed our conversations today. For everyone, please check out, there's other sessions right after ours that you can choose from. I think there's 3 different options. Feel free, today is the last day of the Youth for Youth iSummit. So please take as much in as you can. Keep having these conversations even after we hang up the phone here in a second. Please continue to keep talking. Don't just wait for an international holiday to bring these conversations up, and don't be scared. You matter and your voice matters, and you're so important and vital to this community. Keep talking and engaging, and the love will show up. You are love. Yeah, so please don't be scared to go to the other sessions, contribute, keep asking questions, keep bringing awareness, and I hope you guys have a beautiful day. Thank you so much again to everyone who's listening and watching, and to my beautiful speakers here today.
Thank you.